Hi everyone, hope you are doing very well. So today we will discuss about diabetes mellitus in cats. So there are like three types of diabetes mellitus. We start from hyperosmolar hyperglycemic state, which is also termed as HHS. This is the first type or kind of diabetes mellitus. Then after HHS we have DKA, which is also a diabetic ketoacidosis or diabetes mellitus with ketoacidosis. And the third one, the type of diabetes mellitus is without any complication. So first we discuss about diabetes mellitus HHS, hyperosmolar hyperglycemic state. Uh, First of all, let's have a look on diabetic cat. You can see overweight or depressed skin, hyper polyuria, polydipsia sign are most prominent in diabetes mellitus. So start from the definition. The hyperosmolar hyperglycemic state HHS is a complicated form of diabetes mellitus characterized by the severe hyperglycemia and dehydration. Okay, in such a state of it is such a kind of diabetes mellitus type in which we find hyperglycemia with dehydration. And the other thing which differentiates it from other types of diabetes is that ketone production and metabolic acidosis are not major features of HHS. Ketone production is not a common signs of HHS because ketone production and metabolic acidosis are the signs of diabetic DKA, diabetic ketoacidosis. Okay, so this is a most prominent thing you should note it. Next thing we have pathophysiology. Pathophysiology about hyperglycemia is due to insulin deficiency from diabetes mellitus. You know, whenever there is a diabetes mellitus condition, there is insulin deficiency in body, and if insulin is cell become insulin resistance or insulin deficiency, the glucose level increases and it causes hyperglycemia. Hyperglycemia, then hyperosmolarity develops secondary to the hyperglycemia and is exacerbated by the dehydration. So always you know that whenever there is hyperglycemia and hyperosmolarity occurred, which lead to the azotemia in HHS, which is also a prominent sign in HHS, azotemia. Then hyperketonemia and ketonuria are not major features of the HHS. Also, lactic acidosis is not a feature of the HHS, as we know that ketone production and metabolic acidosis are not the signs of HHS. The next thing, the system is affected are endocrine, renal, cardiovascular, nervous system is also because hyperosmolarity promotes intracellular dehydration and neural function. Whenever there is an increased level of salt, there is a exosmosis from the cell, so hyperosmolarity promotes intracellular dehydration. Okay, so next we have signs are the polydipsia, polyuria, polyphagia and weight loss. These are the prominent signs of the HHS: polydipsia, polyuria, polyphagia and weight loss. There is a weight loss with increased intake. Okay, so it is hyperosmolarity hyperglycemic state. Next which we find on physical findings are hypovolemia, hypovolemic shock find because there is a dehydration, severe dehydration. Also whenever there is dehydration, there is hypovolemia with prolonged CRT, capillary fill time, tachycardia, hypothermia, and also there is seizures because we know that intracellular exosmolarity from the cells leads to the seizures, and then there is a cataracts dogs. It is most common in dogs. So diabetes mellitus cause cataracts in dogs, not in cats. Okay, because hyperglycemia, glucose cross the blood barrier and also leads to the lens, and metabolism will lead to the cataracts. Next thing is cause develops in the patient with diabetes mellitus. Reduce water intakes, whatever the reason behind this. And the risk factor are the heart diseases, renal insufficiency, hyperadenocorticism, are the risk factor of the DM with HHS. Next thing, differential diagnosis, we differentiate from hypernatremia. Severe hypernatremia produce CNS signs similar to HHS, but with sodium as a major osmolar polyuria polypsa may be present. Okay, these are so this is the differential between the HHS and the hypernatremic state. So next, what we find on CBC, hyperglycemia. We find hyperglycemia, which is usually exceed the 600 or exceed severe hyperglycemia exceed the 1500 or 2000 mg per deciliter. Then azotemia, blood urea nitrogen 1 and serum creatinine are also high in blood serum. Then acidosis, you know, acidosis is the most common sign. Then glucose urea. Sorry for that. Acidosis is less common than DKA. Okay, then glucose urea and present. Next thing, what we see, yeah, about treatment nursing care. So first we try to cover dehydration. For dehydration, we give IV fluids. If there is a acute dehydration, then we go for subcut rehydration, glucose supplementation. Okay, so drug of choice for this is CRI of regular insulin, recommended for 2 to 6 hours after starting fluid therapy. So this is a drug of choice for this. Once HHS is resolved and patient stable, discontinue insulin CRI and transition to longer acting insulin to be used for chronic DM management. Okay, this point is most important regarding HHS. Once HHS is resolved, you start from you discontinue CRI insulin and start on long acting insulin. Then precaution, brain edema may occur when hyperosmolarity is corrected too rapidly. Whenever we try to give IV fluid, severe IV fluid, then it will cause brain edema, or insulin administration can result in hypokalemia. Okay, then there is volume and hydration status, keep in mind, and the possible complication that due to the shock or coma may occur in the untreated animal because dehydration may severely leads to the coma and shock. Expected course, you know, hydration and blood pressure with the prognosis will be good. The other names of this condition is diabetic coma, hyperosmolar non-ketonic syndrome. The next thing, next is diabetes mellitus with ketoacidosis. This is a condition, this is a very important condition in which you find that insulin deficiency characterized by the hyperglycemia, ketonemia and metabolic acidosis. This is the most common prominent thing which is found in ketoacidosis. Other are the common signs which is also found in HHS. Okay, so if we look about pathophysiology, insulin deficiency causes an increase in lipolysis, resulting in the excessive ketone bodies production and metabolic acidosis. You can smell or see ketones in the urine or the smell like from the nose of the patient. Then many patients with diabetic ketoacidosis have underlying conditions such as infection, inflammation, heart disease that cause stress hormone, growth hormone secretion, and which lead to the DKA by promoting lipolysis. Okay, the system which are affecting in it are same endocrine, GIT and hematological cats में. Both dogs and cats are affected, but in dogs miniature poodle breeds are most prone to it. Then mean age, this is 8.4 years. Like old age cats and dogs are more prone towards the diabetes mellitus than predominant sex. In dogs, females are most common, and cats, males are 2 times more prevalent than the females. The signs are dehydration, hypothermia, polyuria, polypsia like. But the most thing which you find or which you differentiate on the basis of sign and symptom is anorexia. In HHS you find polyphagia, but in diabetic with ketoacidosis you find anorexia. Due to anorexia you find ketone bodies. Okay, so this is the most prominent thing which differentiate from the HHS. Okay, ketone odor on breath. Whenever you smell the breath, you find some ketonic smell. Then causes are diabetes mellitus, infection like uterine tract infection. This is also a MCQs, or you can important term about urinary tract infection is a secondary or consequence of the diabetes mellitus. So you have to keep in mind urinary tract infection. Then stress, risk factors, history of corticosteroid or beta blockers administration is also a cause of ketoacidosis, DKA. Hyperosmolar hyperglycemic state you differentiate from the by polyphagia. CBC you find hyperglycemia, okay, but then hyperglycemia, lipemia, azotemia, high anion gap you find in ketone bodies, high anion gap, okay, then glucoseuria and ketonuria. In HHS you find hyperglycemia, okay, but there is no anion gap in HHS. So next thing is the drug of choice is regular insulin, maybe subcut, okay, then glucose concentration, IV fluid therapy, serum ketone daily. Potassium supplementation is also recommended because as there is a hypokalemia occurs, then dextrose supplementation, insulin administration without hypoglycemia. Whenever you give insulin, so there is a hypoglycemic state. To maintain hypoglycemia, we give dextrose supplementation. Then bicarbonate supplementation. It is not it will give body weight multiplied by 0.3 multiplied base deficit depending on the bicarbonate deficiency in body. Next is possible complications, hypoglycemia, cerebral edema, pulmonary edema. These are the changes are the same complications which we face in HHS. Then expected course and prognosis is guarded. And the last point which we will discuss is diabetes mellitus without complication in cats. So same, it is a type of diabetes mellitus. So in diabetes mellitus there is an insulin deficiency, and whenever there is insulin deficiency there is hyperglycemia. And in cats the most common type is type 2 non-insulin dependent diabetes, but in case of dog you find type 1 insulin dependent diabetes mellitus. You can cure the diabetes with giving insulin, but in cats there is a resistance of the insulin towards the cell. So pathophysiology about insulin become resistant to cells. Hyperglycemia occurs, which directly impairs insulin secretion by reducing functional beta cell mass. Glucose toxicity is also termed as glucose toxicity you find in diabetes mellitus. So this is other type of diabetes mellitus in which insulin becomes resistant. So we have to, there is a hyperglycemic state become. Next breeds are like Burmese cat, Maine Coon cat. Maine Coon cat is also most common in acromegaly. Then mean age or range is older cats. Also all diabetes mellitus types are more common in older cats and dogs. Predominant sex are males are over same on our history or risk factor are obesity. You find obesity. Then polyphagia and weight loss. This is the other condition which differentiate with diabetes mellitus of other kinds. Like you find polyphagia, weight loss, but in DKA you find anorexia. Then causes are the isolates, amyloid deposition, pancreatitis, disease causing insulin resistance, for example hyperadenocorticism and acromegaly. These are also can be a cause of diabetes mellitus. Risk factor obesity and advanced age. Next we say CBC glucose is higher 150, but in HHS you find glucose level more than 600 or more than 1500. Fructodamine more than 350 level. Just that confirmed that persistent hyperglycemia. It differentiates from diabetes mellitus from stress. So fructodamine test is a reliable test to differentiate diabetes mellitus from stress. So imaging, we do radiography for neoplasia or renal calculi. A diet, we should give diet of low carbohydrate and high protein in case of DM, diabetes mellitus. Surgical consideration, progesterone secretion during dialysis makes management difficult. So intact male should have OVH spay. They should be spared so that progesterone may be decreased in the body. Then there is a drug of choice. Drug of choice is same as usual, insulin in case of diabetes mellitus. So FDA, there are two drugs which are FDA approved. There one in protamine zinc PZI, and other one is porcine zinc lenti-insulin. These are two FDA approved drugs for the cats. Next we have glucose. This is a precautions or follow-up, like glucose curves ideally check, fructosamine levels check, then prevention. You should take care of about obesity, diet maintenance, low carbohydrate, more protein. Possible complications same are blindness, coma, and edema, brain edema are common in diabetes mellitus, but cataracts or blindness are more common in dogs. Expected course and prognosis with treatment and monitoring is good. So that's about all about diabetes mellitus. If you have any questions regarding diabetes mellitus, you can ask in comment section, or you can ask our number. Thank you. Have a good day. See you in next video.